I got to make sure you're here. So great rise in the moonlight, beloved. You know who this is, and you know what it is. Okay, we're gonna be going live over here on Facebook in a minute. Well, less than. So to make sure you're good because you missed out a couple times because we had some technical difficulties. So just want to make sure you're here first. And anytime I'm going live, and for some reason I'm not, um, just go to Facebook and get the videos. Okay, so we about to go live.
You trying to get crazy with this thing? Don't you know I'm loco?
I do not own the rights to the music. All right, but you know who this is. You know what it is. Queen Goddess, the King Advocate. It is Melanated Monday. We got my guests coming on. This is what we're talking about right here.
Just toss that ham in the frying pan like spam. Run when I come and slam. Damn, I feel like the son of Sam. Don't make me wreck. The check got me going like General Electric. And the lights are blinking. I'm thinking it's all over when I go out drinking. Oh, making my mind slow. That's why I don't with the big bro. I got to maintain. Cause like me is going insane.
Come on, y'all. Come on in here. We're talking about the. Come on. Part 6. So level up series. Okay, we gotta make sure everything is taken care of. Everything gotta be in good health. Okay. So come on in.
Don't try it. Attack your ass like a looter in a riot. Back like a sumo, slamming that ass, leaving your face in the grass. I don't take a pillow lightly.
Now, come on. I guess we'll be in here momentarily, about 4 minutes or so. I'm gonna just turn this down as I get ready. Get ready. Please, if you have not already let other people know what was going on tonight, start sharing the video. Just start sharing the video. Make sure you have something to take note with, because the conversation tonight, hopefully, I think is going to be deep. Okay, it's going to be definitely interesting. Okay, and very informative. So make sure you have something to take note with. I'm going to definitely have the phone lines open so you can call in and speak directly with the doctors if you have anything in particular you'd like to ask. This is something that we've never had a conversation about, and we're going to change some things. Okay, you all know I like to touch things that are, or touch subjects that are not common, things that we need to be talking about. I'm turn it off now. Things that we need to be talking about, and tonight is one of those. It's one of those topics. Okay, so I will be joined live with Dr. Peter Bauth and Dr. Frank Patterson. Okay, they will tell a little bit more about themselves specifically and directly. So if you have any questions that you want to ask them, feel free to do so. I see you all coming in. I'd love to know who it is so I can greet you properly. You know how we do. Come on now, show your face. Show your face so I can speak to you right. All right, let me get this out the way. Again, tonight's conversation. Do you know even what your brain says about you? What's going on in there? What are the things that even make it function? What does your brain connect to? How does it affect different things? I'm going to be asking some questions that you all probably had no idea were even connected to the subject matter. So please come on in. I said the doctors will be on shortly. I'd hate for you to miss anything. I'd hate for you to miss it. Okay, this is probably going to be your first, maybe your last, hopefully not, opportunity to ask questions about something that you've probably never even heard of. Okay, these, and I'm gonna be very transparent, but you all know that I'm honest about things. I'm open. Um, so you know that I'm real. You know what's going on. You know it's real. Okay, so there will be some things um, said about me, and I gave them permission to give you And if you connect with that, if you have some similarity to some issues that I have dealt with or managed or whatever, let's talk. It's all about healing. Okay. It's all about healing. So y'all come on in. I see you here. It's like you're in and out, but come on in. Because once the doctors show up, which will be shortly, they got what, maybe a minute or two. They'll be here in a minute. Okay. So once they show up, we're going to get live. Okay. And like I said, I really hate for you all to miss this, but I'm not going to not have this conversation if y'all don't come. Okay. So come on in. This is gonna be a super show. Super show. Come on in. I will give you a moment before I actually get started getting into some things. Dr. Frank is in the building. So I need to give you an invite. Let's see. Dr. Frank, I don't want to do any of those. It says block, delete, or pin. You got to come in a different way, I think. I need to see your icon at the top. So let me see if I can do it this way. Did you friend me? Let's start with that. did did you friend me? Because like I see that you're there, but I need to be able to pull you in. I said worst case scenario, you may be on a phone call. Worst case, but I would like for you to be here, have your face here. If not, I don't recall seeing it. So you can go out, or if you need to go out, just do it now and then come back in and we can do it. Okay. Because I can't pull you in because I don't see you other than in the comments. So you can do that. And we're still waiting on Dr. Bauth as well. So you got a moment. It's okay. No worries. We got this. No time frame. It's on my time. So come on in. G Walker, I see you, loved one. I appreciate you for being here. Appreciate you. I'm sure you will probably have a question or two. So you know I'm going to open the phone lines once we get started. You're following me. I need you to friend me. I need you to friend me because see all these this comment that's coming up with G Walker says bring them on camera. I need to have that option with you. He's having difficulty getting on as well. Huh. Just go to my page, which you're clearly on. I'm going to go to my page and go to my page and go to this live video. He should be able to come on in. He's definitely a friend. So let me see if he's there. Let me see. Okay. So I was able to send him an invite. Yes, sir. I see you, G. Yes, sir. Yes, sir. And yes, sir. So hopefully, one or both of you will be able to get that to come on in. Okay. I said, worst case scenario, I will just bring you in on, it'll be a phone call. It'll be a phone conversation, which is fine. As long as the people get the information. If they don't see your face, I'm sorry for them. As long as they get the information, we'll do it that way. So I'll give you a minute. You know, if you need to go out and friend me, come back to the live page, your picture would show up at the top. I'll be able to invite you. So let me try something real quick. I'm gonna try something again. Hold on a sec. Nope. I was trying to see if you were in my list of friends, but you're not in my list. So go in there and friend me. Go friend me so we can talk. Worst case, you can call in 770-906-5271. 770-906-5271. Okay, I'm gonna try to, let me see if I can, I'm gonna try to bring you in. Like it's not giving me an option with you. So you're just coming in as a comment. You're more than a comment. I need you here. I don't know what's happening, why that happened. Keep trying. Or just call 770-906-5271. But he's having difficulty too. The devil is a lie. We're not doing this. Okay, let's see what we got going on here. You're here as well. Okay, so your icon needs to show up. Okay. I need to be able to see you. You friended me, but you're not showing. So something is not happening on your end. Something you're not doing on your end. G, maybe you can help me out. What's the options here? Will it work with this profile? Um, is this the pro? I don't know. I'm not understanding the question. Will it work with this profile? Let me see something. I don't know. Yeah, both of you are coming in the same way, and I'm not certain about that. Miss Dr. Bauth, I know I sent you an invite, so I don't know if you saw that or not. I was able to send you an invite. But Dr. Patterson, I'm not able to send an invite to. Let's try again. You all stand by, please. We're having a little technical difficulty. Just a little bit. I'm not certain. Yes, 770-906-52. Wait, 71. 770-906-5271. You requested me as a friend. No worries, you need not apologize. Let's see what we can do here. Okay, so here's what we're going to do. I'm going to go out. I'm going to go off. Well, I'm going to try not to, but in the event that I go off completely, just come back. Okay, so just like stay tuned, right? And just come back. I'm gonna try something. Is Dr. Bauth, you got an invite. Something told me to do this beforehand. Okay, I'm gonna go out and we're gonna come back in. So technical difficulties have happened before, but me leaving and coming back, I've never done it. So congratulations to us. We're doing something that's never been done before. So I'm going to go out, give me 2 minutes, and I'll be right back. Okay. G, you come back too. Okay. I'll be right back. Y'all hold on. what we not gonna do is have a problem where we can't get in. Okay, that's what we not gonna do. Okay, so we got that one. Okay, so we're gonna try it again. We're gonna try it again. Okay. All right, all right, all right, all right. We trying this again. We are trying it again. Y'all, come on back. Come on back. Cause we are having this conversation, and we're having this conversation tonight. Okay, we're having it tonight. No matter what, we are having this conversation tonight. That's what somebody is really trying to not have this done. What's going on, sis? Thank you, love, for being here. I appreciate you. We had some technical difficulties. I had to leave and come back. So hopefully the doctors will be able to join me again. Let me see, who is this? So just give me a moment, okay? Just be patient. Don't leave. Be patient with me. Wait for them to come back in. Yes, I'm getting the texts. Come on back in. Yes, ma'am. Okay, G, thank you, love, for coming back. I said, stuff be happening. Stuff is happening. Okay. But this is a sign when all your shit start going haywire and you know that you doing what you're supposed to be doing, and you know that the enemy is after you and been after you, and but it, again, we're in a season of judgment and stuff is turning. This kind of thing happens because your enemies they don't want to see you come up, right? That energy, it's out there. Don't want to see you come up. That adversary don't want to see you do what you do. I'm gonna get it done though. Okay, it's been said. It's gonna get done. Okay, it's gonna get done, son. Okay, quit playing. Touch not my. Okay, hello, somebody. Don't keep playing with me. Don't do it. Don't keep playing with me. Let me spiritually put that out there. Don't keep playing with me. Because God don't play about me. Okay? Don't keep playing with me. Don't do it. Don't do it. So hopefully the doctors will be able to come on back in. Why can't you get through? Try again. Call now. What I don't know what's happening that you're not able to, but try to call again. Because I'm holding the phone. Okay, try again. Try again. Try again. I think I got you. Try again. We having this conversation. Yes, we are. Let me see. Do you have a Griffin number? Because I'm going to call you.
Hello, you've reached Dr. Frank Patterson. If you'd like to speak with
Dr. Bauth.
Hello, you've reached Dr. Frank Patterson.
Hey, hold on. Let me switch over real quick. Hold on a second.
Your call to extension
Me
0.
Let me hang that up.
Your call to
Lord. Do I have everybody on the phone?
You got me.
Okay, let me see.
Can you hear me now?
Dr. Patterson
Yes, see.
and Dr. Bauth.
Okay.
Okay. See what I'm saying? That's that negative. That negative energy and feedback. Do you all hear that feedback?
Yeah, so I turned my laptop down, so all I'm hearing is
Okay.
the phone right now.
Okay, cool.
Myself as well.
Okay, very good, very good. I talked one way or another. We were having this conversation. That's that that energy. We're not doing it. We're not doing it. So we're here, everyone. We are here. We are live. We have made it one way or another. We have made it. I hate that you all weren't able to get in on the video, but you are here, so I can at least ask the questions. We can talk. How are you both?
Well, I'm doing well.
Okay. Was that Dr. Bob?
Yeah, I'm excellent, Kim.
Good. How about you, Dr. Patterson?
I'm doing well as well.
Good. Okay, so we're gonna get in this. First of all, let me just thank you both for agreeing to be on this show. I've never had medical doctors or doctors of any type on the show, but I feel that what you all do is extremely important. It's something that we do not have conversations about. I don't think a lot of people know about it or the benefits of it. So I thank you both for taking the time out of your busy schedule to join me. And let everyone know, I'm letting everybody know that these are my doctors, okay? And I told you, I'm very transparent. I don't have a problem telling you my business, okay, to a point. But feel free to ask whatever you need to ask. I'm going to let the doctors talk for a moment. I will ask you questions. I'm not going to put you on the spot like that. But I do want you both to explain a little bit. First of all, tell a little bit about yourselves, and then explain a little bit about what chiropractic neurology is. That is what we're talking about today, chiropractic neurology. So whoever wants to start first, to introduce yourselves and give a little something about chiropractic neurology.
Well, let's go beauty before age, and so I'll let Dr. Patterson start.
Of course.
Thank you. I appreciate that. So yeah, you wanted to know a little bit more about chiropractic neurology and what exactly it is?
Yeah, and about yourself, because you got like 99 letters after your name. So give people a little bit of information about what you do and what chiropractic neurology is.
Cool. Yeah. So just like in medicine, there's different specialties in chiropractic. Like if you go to an MD, you could be seeing like a more general practitioner. You could be seeing like a cardiologist. You could be seeing a radiologist. There's different routes that you can specialize in medicine, and it's somewhat similar to chiropractic. There's chiropractors that specialize and have special certifications in sports. Certain ones that specialize in pediatrics, and in our case, certain ones that specialize in neurology. But we're a little bit different from your medical neurologist. We run some similar testing. We learn our examination skills, which comes directly from the medical neurology world. But we just look at the details at kind of a finer level.
Okay.
Where they may say you're mostly normal, so you should be mostly good. There may be truth to that, but we know that sometimes, the very fine detail, the very small findings that they may come across, if we can make changes in those, it can lead to feeling and functioning that much better. And that's one of the things that kind of separates us. So both Dr. Bauth and I went through chiropractic school, but then we did postdoctorate training in neurology. And then if you wanted to put a label on what we do outside of calling it chiropractic neurology, you can call it brain rehab or neuro rehab.
I like
so
it.
You might go to a PT because you sprain your ankle to do exercises to strengthen muscles, right, or get your joints moving better. But people come to see us to get their brain working better by doing some different types of exercises that we can talk a little bit more about. But we do these different types of exercises. Your brain starts working better, and then, you know, the challenges that you're having in your life with a better functioning brain can start to improve.
Absolutely.
And our brain controls pretty much every function in our body, so it's pretty incredible how far-reaching doing neuro rehab or chiropractic neurology can be.
Absolutely. I like how the term you use, brain rehab. A lot of us need that.
Yeah, you know, there's a lot of people that do rehab on like their back or their knee, you know, or their neck or their elbow.
Right.
But there's not as many people that are doing it on their brain. And, you know, technically you can get a knee transplant. We're still working on the whole brain transplant.
Right.
We haven't quite perfected that yet. So I don't think that's coming anytime soon.
Yeah, I don't. It's being replaced with AI. So yeah, it's coming.
Yeah, but, you know, I still think we're ahead of AI in so many different ways.
Yeah,
you know?
absolutely.
So.
Absolutely. Well, thank you for that, Dr. Bauth.
Yes.
Your turn. Tell a little bit about yourself, and if you want to give your own spiel on what chiropractic neurology is, please do so.
So I like what Dr. Patterson said. I'll plus it by just mentioning one of the ways I like to refer to it as receptor-based therapy. And so it sounds a little fancy, but it's not. You have receptors in your body for darn near everything: for light, for sound, for taste, for touch, for smell, and for vibration. You name it, right? On and on and on. Mm-hmm. And so those receptors can get either, like on a dimmer switch, they can get turned up and be working too effectively, or turned down and not be working as effectively. And so when that happens, it's literally like the circuitry of the brain goes off. Not off as in a light switch on and off, but off as in not functioning like it should.
Right.
So the whole idea is, you know, what can we do functionally to get those receptors and to get the circuitry of the brain working better?
Right.
So that's the only plus I'd add to Dr. Patterson's explanation. I thought it was great.
Absolutely.
Personally, you know, I got into the field of healthcare because a chiropractor helped me with my asthma. And as years went by, I realized, you know, so many different people were seeing chiropractors for so many different reasons.
Right.
And it, you know, one of the reasons is that, as Dr. Patterson was saying, when you go to a medical doctor or let's say a standard physician, generally the approach is to look at, you know, can we do something about this with a drug or a surgery? And if we can't, then, you know, we're kind of outside that zone of treatment. Well, we look at the functionality of the body, and we're afforded a great amount of laterality there. We can do a lot of things for people because those are the things that people don't look at, is
right.
the functionality of the body.
Right.
So with you know, I've been really blessed to meet some excellent and admirable people, Dr. Patterson being one of them. And so our team is really a team of individuals who takes a look at the brain and all of those different pathways in and how we can work together to make them work better.
Absolutely. I think one of the factors, well, that's probably not the right word, but one of the things that people don't consider is how many different functions the brain is responsible for. You know, we pretty much just related to like what we think, how we think, how we process. We'll do it on that, but we don't really connect it as far as like how it really affects certain movements of the body, or how it can affect your thought, how it can affect your mood, how it can affect healing processes, emotional processes. So we don't really give the brain a whole lot of credit for all the things that it does. So we tend to take it for granted. You know, I think we need to have a better education, if you will, on the true importance of making sure that brain is healthy. Like I said, we'll take care of our heart, we'll take care of our reproductive systems and all that kind of stuff. But when it comes to the brain, we just assume it's just going to automatically do what it's what it's supposed to do naturally until it doesn't. And then by that time, there's an issue. So,
Right.
yeah, we want to get these things addressed ahead of time. So I have some questions. And both of you can answer, please. What for you as a doctor makes a perfect candidate, is if there is such a thing? What type of person do you say, yeah, we can definitely do something with that individual, or yeah, they definitely need to come see me? What's a perfect candidate?
Who's first?
Whoever wants it. How about you? You asked the question.
All right. So we're going age before beauty this time. Okay. So the perfect candidate is one that I can help. and that sounds a little tongue in cheek, but one of the things that we do at our office is before we see anybody, we do have a consultation, and then during that consultation, we'll kind of get an idea if it sounds like a good fit. The second thing we'll do an exam. And that exam flushes out a lot of uncertainty, and then we'll know based on the exam what should work, and then we do what we call therapeutic trials during that exam to see, can we make an effect on the system. So one of the nice things is, in other approaches, you go into a place and you might be on a medication, or you might be on a particular therapy for months before it's looking like it's working for you. With us, we know pretty quickly. We know pretty darn quickly because the exam pretty much indicates what needs to be worked on. Much the same way that, and this is I'm using this very loosely, but much the way that an electrician will be able to figure out where in the system the circuitry is shorted out and be able to address that. We can do that with the exam, and therefore we can save a little time and money, both our time and your money, is to figure out and be able to come up with a care plan that we can expect some results with. And because of the testing, we can go back and test rather quickly on the spot to see if it's actually working or not.
Right.
So the ideal per person is somebody we can help. And, one of the funny things is, in our discipline, people have usually been to a dozen or so providers before they come to our office. It's almost standard. We can take that to the bank sometimes. And so, quite frankly, by the time somebody's been through everyone and they've been told the same thing, this is your new norm, you'll have to learn how to accept it.
Right.
You'll have to learn how to live like this. That's our ideal candidate, because no one's ever looked at their brain before.
Right. That's true. Very true. Dr. Patterson?
What do you think, Doc?
Yeah, I think that's a great way to describe it. I mean, we can talk about different challenges that people have to come to see us, but ultimately there's a lot of people that come to see us and they're like, I'm not quite sure what I've got going on, but I was recommended to come see you all. And then we do that exam and we do that testing and we talk about what their goals are and what their challenges are that they've been experiencing, and then we're a good fit for them. But if you had to put categories down, some of the categories people of the challenges that people are dealing with that we see are people that have had a traumatic brain injury, whether it's one like a stroke, or maybe they had a concussion, whether it be sports related or from some kind of accident or fall.
Right.
We see people with autonomic nervous system issues. There's a thing called POTS, where if you're not familiar with it, there's not a lot of people that aren't. But if you've got it, you're probably very familiar with it.
Okay.
It's where your autonomic nervous system, your automatic functions in your body start to go wacky, and when you stand up, you get a really fast heart rate, you get really dizzy. We see a lot of people with dizziness and vertigo type issues. You see people where they have tremors or tics.
Right.
Or they've got what's called dystonia, where their limbs start to kind of lock up a little bit. Maybe it gets really hard to move their arm, but it's not like they had a stroke, or maybe their head kind of gets stuck looking off to the left. That's that type of dystonia. People with, pretty severe balance issues, people with anxiety. Those are just some of the categories. We see kids with developmental issues, whether it's, they don't really fit in a category.
Mm-hmm.
I could tell you about one patient that didn't fit in a category that got help with reading at 30 years old.
Wow.
I can tell you that story.
Wow.
But more oftentimes, it's kids with learning disabilities or autism or ADHD, attention type issues. And at times, sometimes with behavioral type issues too, if there's some neurological basis for it.
Right. Okay.
So does that kind of cover a lot of the broad categories that we see, Dr. Bauth?
I think so. One of the things about our team is that we have what I'd like to call a pretty good group of individuals with a certain penchant for issues. Dr. Melissa Campbell is part of our team, and she's fantastic with certain movement disorders. I live in this area of the brain called the limbic system, which is your emotional brain, and there's little subsets of that, like the amygdala, which fires strongly in fear responses. And Kimberly, because I know you've talked about this, we live in a society that's an on-guard society, a get-ready society, a watch-out society.
Right.
And what's being driven to us and what's being pushed towards us every day is be afraid.
Yep.
Be afraid of them, be afraid of somebody coming to take your job, be afraid of somebody who doesn't look like you, be afraid of somebody of a different gender, of a different nationality, a different religion, et cetera, et cetera, et cetera. And there's all this fear, and fear spreads faster than most contagious things.
Yes,
right?
Sir.
And so, personally, an ideal candidate for me is somebody who does have those social phobias, who does have those anxieties and the depressions and the thoughts that won't let them sleep at night, etc. So, we're all a little different in terms of what we like to address, but it all goes back to, can we make the effect through our therapies, which are brain-based? And that's just something it's such a wide open category because, again, every structure and function ultimately is controlled through the brain and nervous system, whether it's, your heart, your stomach, your movements, your thought processes, et cetera, et cetera.
Absolutely. So one of the questions that was posed is, what about multiple sclerosis?
I saw that.
Okay. Okay, good. So you are still on, so you can watch. Good. So Dr.
Patterson can chime in anytime. There are classifications of things that we'll put under an umbrella term of autoimmune.
Okay.
And autoimmune is one of those areas that's a little tricky because, traditionally autoimmune is that the body is quote unquote attacking itself. Well, on its face, I guess that's a fine way of explaining it, but, it flies in a little bit in the overall approach of the body, which is that the body has this innate ability to self-regulate and heal. And so if you look at it from that way, why would that turn off? Well, we don't look at it as though it turns off. We look at it as though the system is looping on itself for some reason, whether it's a toxicity issue or a undetected immune system problem. But usually autoimmune issues have to be dealt with kind of with kid gloves. And what I mean by that is you can go, the harder you go with them, usually the worse results you get. So what we like to do is kind of go brass tacks in terms of brain. And then we usually wind up recommending some type of metabolic assessments for those people and looking at anything from toxicity to diet to environmental stressors, etc.
Okay. Very good. Dr. Patterson, do you want to chime in?
Yeah, so multiple sclerosis, it falls into that category of an autoimmune disorder like Dr. Bauth was talking about. We've seen people with other types of autoimmune disorders as well. And unfortunately, there seems to be potentially some autoimmune type components as well with people with long COVID issues, which we see a lot of as well. But with multiple multiple sclerosis, Claire mentioned that she has 6 lesions on her brain, right? So with that, your immune system can start attacking kind of the covering on the nerves and the neurons, right? That are involved with the wiring in our brain, and then you can see these lesions. So what we need to do is we need to calm down that inflammation process that's involved with that, and that's where that metabolic works that Dr. Bauth mentioned comes in, and what that typically looks like is like lab work, where they kind of look at fine detail a little bit more. Typically you're seeing somebody that's like a functional medicine practitioner for that, and then they may prescribe some things to help calm down that loop that you get stuck in, calm down that inflammation process, right? And then what we need to do then is we need to retrain the brain how to fire the pathways that have been affected with those lesions, right? And then sometimes we need to use backup systems as well, because fortunately our brain has backup systems. We just need to help unlock those things.
Right.
With doing some exercises to get your brain functioning better. So it usually winds up being a multi-pronged approach with something like MS or another autoimmune disorder. But, trying to clean up the autoimmune aspect as best you can is going to be helpful. And then doing that neurological rehab to get things firing appropriately is going to be important as well.
Okay.
So
Dr.
kind of a 2-pronged approach.
Gotcha. Dr. Bauth, you mentioned briefly the limbic system and it being the emotional brain. Can you go a little bit more into that?
Sure. So, if we take it from a cellular standpoint, right, because we're basically a community of cells, fair?
Yeah.
And kind of the joke about this is we're always finding more. I remember being in high school and there was we had 50 million cells. Well, we're up north around 50 trillion right now. So we didn't gain, several trillion since that time.
Right.
We just found more, right? So whether the number is 40, 50, 60 trillion, the numbers matter not. The essence is we're basically, our bodies are a community of cells, and each of those cells has its own job to do, and then those cells coalesce and form other tissue, and that forms different levels of organization in the body, so that some cells all then differentiate to work as a liver, and then some cells differentiate to work as a skin, and some cells work as reproductive system. But ultimately, what you can say about a individual cell, you can say about the human organism, which is that it has a protective ability and it has a growth ability. And so you can either be, as a cell goes or as a human goes, you can either be in growth or you could be in protection. You can't be in both. And so protection is there to save our lives. It's the system, if you're walking through the woods and you hear the branch crack, that the hair will stand out at the end and the pupils will dilate and the heart rate will quicken, because that might be a threat to you that you need to run from or fight. And so if there's an attacker, you go into what's called fight or flight,
right,
or sometimes freeze. And when that threat is gone, you come out of that. So that limbic system modulates and mediates that. So the fancy way of saying it is hypothalamic, pituitary, adrenal axis. Your hypothalamus tells your pituitary to tell your adrenals, you better go or you better fight.
Right.
And again, with that, depending on your surroundings, your upbringing, your how you've been taught to think about things in life, you may be in that fight or flight constantly. You may be constantly locked into that phase.
Right.
So what I do is I help modulate the system to get you out of that threat trauma response, something that you also might be locked into because of a previous trauma, so that your system can shift away from protection back into growth.
You just answered my next question. I was definitely going to ask about the trauma as far as the limbic system, and if a trauma can cause the limbic system to respond incorrectly.
Well, again, I'm not so sure as I believe in an incorrect response from the body. I believe that the body has a innate ability to respond to any stressor the best of its ability. Now, that is where we find a little bit of changeability, because your best is going to depend on a great number of things. For example, if your diet is full of, ding dongs and Mountain Dew, your best might be not as good as somebody who, maintains a diet of fresh fruits and vegetables. And so, if you're constantly under stress, your ability to modulate that incoming stress or to heal from a certain trauma may not be as good as somebody who does have the ability to do that, right? So the ability is there for us all. Fair? And if we're alive, we're self-healing and regulating. You cut a piece of steak, it's going to never heal, right? There's no life there.
Right.
But if you're a sentient human being, if you're alive, you have the ability to do it. Whether you do or not depends upon a great number of factors.
Absolutely. Okay. So again, you answered the other question I was going to ask, as far as like how does the brain or the nerve relate to trauma? Like what is the correlation? So you kind of touched on that. So we hear this we hear this phrase all the time, and both of you please chime in. It's funny, but there might be something to it. When people get agitated by other people, they'll say you're getting on my nerves. You're on my last nerve. What, if anything, does that truly have to do with the brain's response to whatever is going on? Is that really a thing? And like, where did it come from?
Go ahead, Doc.
Well, I think, that's when, we're talking probably in that case about, maybe the nerves or the neurons that are associated with that limbic or emotional system.
Mm-hmm.
But it can be a challenge too, because sometimes the way we interpret the world is the problem, right?
Mm-hmm.
Because our sensations, right, give feedback to our brain, and then we reference that with our past experiences and our emotional state, right? So our memories and our limbic system, if you're already irritated, seemingly little things, or things maybe you'd laugh at, if somebody makes a joke and you're like, that's not funny now,
right?
Because you're not in a good place emotionally, right? And then there's another avenue, like we could all probably relate to the memory thing, or we're in a bad mood, and then you're getting on our nerves,
right?
But there's also another issue where our sensations are out of whack, right? Where maybe we're really sound sensitive. This is pretty true for kids that are living on the autistic spectrum, for children or even adults that have what's called sensory processing disorder, where our sensations are either ramped up or they're starved and they want more, right? And if we're in that ramped up state, sounds can be much louder. The person next to us may be like, oh, this baseball game is exciting and everyone's cheering and, I'm getting caught up in the excitement. But for a kid with sensory processing issue, it may be like 10 times louder for them. And it creates a terrifying place.
Okay.
And then I mentioned too about people that have challenges really with their autonomic nervous system. And those people with POTS, where they change the position and their heart rate spikes. The reason their heart rate spikes is they stand up, and instead of their blood vessels constricting and making sure we have good blood flow up to the brain, they don't constrict, our blood pressure kind of drops, and our brain senses that, and it's like, oh shoot, we need to get blood up to our head.
Right.
So it starts pumping our heart faster, but then our heart's racing. And then that triggers, if our heart's racing, then our limbic emotional system might be like, wait, when my heart races, usually something scary is happening.
Right.
And then we might start to have memories come up and pop up from previous times when our heart was racing. Maybe it was when somebody was yelling at you.
Right.
Maybe unfortunately it was when somebody was hitting you, right? And this could just get triggered from somebody just standing up, right? Because their autonomic nervous system's out of whack. So these challenges, things getting on our nerves, right? Sometimes it's from outside things like sensations, whether it be sound or taste or touch, you know, and that processing is a little bit off, right? Or maybe there's like an emotional event or just our emotional state. But sometimes it's just like how our brain's supposed to be perceiving like everyday sensations, right? And it just winds up certain systems, and then that winds up our emotional state. Does that kind of make sense?
It makes a lot of sense. I mean, it's a lot to say, a lot to take in, and it may also take a while to process all, but it definitely makes sense. I appreciate that answer. I keep my habit is say, well, if you want to call in, feel free to do so, but I got you all on the phone, so that's not happening tonight. So if you have a question that you want to ask the doctors directly or directly, text it, put it in the comments. They can see what you are typing and they can respond directly. If anything has popped up that I might not be looking at right now that you want to respond to, either of you, feel free to do so.
Yeah, I was just going to mention that the young lady, I think it's Clara, who's been really active in the chat tonight. She's certainly free to call anytime for, you know, a no obligation consultation if she wants a little privacy to this, because I understand that it looks like there's a lot there. We can maybe flesh some of that out for her.
Yeah, for sure. So we got a call. I don't know. I'm going to see if this is going to work. So let me see if I can pull him in. Hold on a second. Okay. Hello?
Hello?
Do I have 3 people on the phone?
Well, you've got me. This
Okay.
is Dr. Bauth.
Okay. Do I have Dr. Patterson? I do not. Do I have G. Walker?
Yes, you have Mr. G. Walker.
Okay, so Dr. Patterson got wiped out. Okay, so he.
No, I'm here.
Okay,
I'm here.
good. Excellent. Okay.
I'm just trying to let it speak.
Excellent. Okay, G. Walker, what's going on, love? What's your question? What's your
I
comment?
just want to make a quick comment. This is excellent dialogue, and I just want to say I have a comment. I don't have a question because I understand exactly where it's coming from. Because I too started off as a pre-med student in college, even though I finished in another degree. But I know about it like the doctor. I forgot which one said. I can break the body down to you molecularly and cellularly. I'll tell you like this. I say it like this. The brain gives you something to think, that lets you know that you can think, whether it be medulla, thymulus, thyroid, which is located in the breastplate. But your mind tells you what to think about. Now, this is where these doctors come into play at. Your brain cells, if they're off, your cells, molecularly, your atom, proton, neutron, electrons, if they're off, that's where these doctors come into play, and God bless these doctors for coming into play. I hope I'm hitting the ball out of the park because I know I am. But that's where these doctors come into play at. Where you are chemically or molecularly thrown off, whether it be, like you said, from a drawing of the brain cells or whatever the case might be. I want to think this way, but I can't because something is distracting. Something is prohibiting me. I know what you're saying, but I can't get there. That's where the doctors come into play. And I just wanted to say thank you to you.
You're very welcome. Thank you.
All right.
Thank you, darling.
You're welcome.
Okay, we'll talk soon.
Salute.
Salute. So, like I said, I like to be transparent. I've told everyone these are my doctors. Okay. The reason that, I'll say one of anyway, the reasons that I started going is because of an accident that I had, a head injury that landed me in the hospital for 3 days with a concussion and unable to speak. I could not respond. I could hear and see everything that was going on, but I could not respond. This happened, I think, maybe 5 or 6 years ago. But after that point, it became very difficult. I had a period where I was stuttering, or it paused my speech for a minute. My processing was off. It's still a little something, but it's definitely getting better. I didn't know what to do, how to do it, why I should do it, or even if it could be done, whatever the it was. So being able or being introduced to Dr. Bauth and Dr. Patterson and Sophie, she's not here, was a true blessing to me, because it not only is helping me I'll heal, I'll say that, but get a better overstanding and respect for the brain, the mind, and those who were gifted and called to help it heal. Like, this is so major to me on so many levels. And I look at it also from a standpoint of cultural trauma. And Dr. Bauth, I think me and you spoke about that. I think I spoke to both of you about it. But as far as cultural trauma is concerned, as Black people, melanated people, there's a history, and not to take away from any other culture's history, but there is a history, and it continues, that kind of keeps us in a traumatized state, and us not having conversations about it, not being real about it, not seeking help on our individual issues, let alone collective, is to me a major problem and a reason why things keep happening. So my question to both of you is, one, how does it affect cultural trauma, basically? How can what you all do help the healing process where cultural trauma is involved? That might be a pretty deep question, but
well, I mean, it's a complete evening long question,
yeah.
right? So we can spend an hour on just that alone. Yes.
Yes.
We can spend a week on that alone.
Right.
Yes.
Right.
Absolutely.
And so I'm going to take and I'm going to give an opportunity here for Beauty to go here, but for myself, when we talk about any type of trauma, whether it is physical, whether it is chemical, or whether it is emotional, and we can break down emotional into what we call autosuggestional, which is the best way of referring to that would be suggestion to oneself or to others. It is the perseverating thought process that one has. And one can have those things from day one because of environment or social norms. And so, Kimberly, you and I were talking the other day, kind of whimsically, if you will, about good hair, right?
Mm-hmm.
And the idea of what is beauty, and how little girls view what is pretty and what is not pretty. And so I mean, it's been said. I'm not the expert here, but over and over, it's like, if you have so many sources of stimulus coming in about what definitions of beauty are, then you start to see yourself something less than.
Right.
Right. And when does that start? Day one or day one?
Right. Probably
right?
day one.
Yeah, day one. And so we can talk about things intrauterine. I'm happy to do it. But again, it can go pretty deep. As a matter of fact, I've got a video of an argument taking place, and you can see the fetus reacting in the womb to the argument that the parents are having. So we understand that It's fine. We'll put it to the side for right now. Let's just say from day one, we have that energy coming at us.
Right.
Neurophysiologists teaches us that up until the age of 5 to 7, we're pretty much tablets just downloading information.
Right.
We're not, our brains aren't firing at a calm consciousness brainwave pattern yet. They're firing at a mimic brainwave pattern. So what that is to say is that we're learning values of self and what we're able to do, what we're capable of, what is right, what is wrong, what is love, what is not, all of these things from a very, very early age, from day one. And so you want to talk about cultural trauma, that can get spread because people's idealisms and ideologies can get spread to the youngers. Right. And so, we kind of repetitive things. There's no difference whether you're talking about learning how to hold a baseball bat and pitch it before you can even write a pen. Pick up a pen and write something on a piece of paper. It's patterns of thought that get put into one's mind before they even realize what's there. And then 20 years later, they have thought processes that they don't even know where they came from.
Absolutely. I want to interject right there because I have talked to, I've said this so many times over the past 8 years on a spiritual level. When I talk about the representative and people looking like, I don't know what the hell you're talking about. But I've said that, we all have a representative that basically, like I said, has been there since day one. And I'll say that it has waited, but not so much. It has waited for the exit of, from the exit of the womb to jump into the physical form, which is probably there before. But what happens is whatever this thing is, this form is a form of consciousness. I'll put it that way. Whatever this form of consciousness is, it has caused us to be live, that it is us, that it is the true us, that what it does, what it thinks, what it feels, how it moves is us. It operates as us from day one. And because we don't recognize that it exists, we be live that that's it. We don't understand why we're feeling certain things, why we're thinking certain ways, why we've done something. And that's, when we're asked, well, why did you do such and such? Well, I don't know. Well, yeah, you don't, because the true you probably didn't do that, But is it that representative? It's basically what you're saying. I'm just putting it on a spiritual level. It's a representative. It is another consciousness that it has been there since day one, and not recognizing that being exists causes us to basically feed it and allow it to grow and take over and put the true us in the background, on the back burner, not able to grow. We're basically stifled because we have no idea what has transpired from day one. So I don't want to take that too much further. Dr. Patterson, do you have anything you want to add to that?
Yeah, Dr. Bauth and I, we've talked about this actually somewhat recently. There's kids that I've worked with. I've worked with a lot of kids that have been adopted, and that's a population where there seems to be a lot of trauma. And you could understand where that could make sense from the standpoint of maybe adopt a 4-year-old kid and they were in a very traumatic home environment. But some of the kids I've worked with, they were adopted, right after birth. And Dr. Bauth kind of touched on the whole, things that happen in the womb are going to have an effect, and that's absolutely the case as well. But there just seems to be these things for some people where, whether it's cultural or societal, it just gets ingrained within us, like you're saying, it's almost there waiting, for the right moment to latch on. Right. And then it trying to kind of take over and nudge out our true self. And it can be tricky because, there's different triggers that can put you in that direction of this other structure outside of yourself.
Right.
And that's, those are some of the things that we try and unwind, whether it's at an emotional level or like a neurological level. It's like one area of our brain. I often use the analogy of like siblings. Like you got like 2, 3 kids. 2 of them can be fine, but then the third one gets agitated, and then all of a sudden all 3 of them are agitated. So maybe it's that limbic emotional part of the brain is actually in a cool, calm state.
Right.
But then, its next door neighbor, its cousin, like the brain stem gets ramped up because we get in that fight or flight state, like I said, because you change position. And then it allows that limbic emotional center to take over, and then it allows that, that societal structure that's, somewhat separate from ourselves, but also ingrained, to take over and drown out our true self.
Right.
So it can be like a sticky process trying to unravel that and unpeel that. And that's why it's important to, look at it from multiple different angles. And like Dr. Bauth said, that's where it's nice with us working together as a team. We have different specialties. My specialty, like we all have similar foundational training, but like Dr. Bauth is certainly, probably the strongest in the office as far as working with that anxiety, emotional side of things,
Right.
So that's one of the things that drew me to this practice. We have, it's funny, our founder just brought this up, as far as in our subspecialty, there's not many large practices where we have 7 doctors. There's maybe 1 or 2 other clinics in the world that have 7 doctors that are doing the same thing, working together as a team.
Right.
And collaboration is a big thing for us, because it takes a collaborative effort to bring different perspectives to the table, because we need those different perspectives, because there's so many things that can be at play here.
Right.
And like you're talking about, like societal structure is one of those things. I don't think we can, I'd like to think we as individuals can try and move society in a good direction. That's not our main focus in the office, but hopefully we can help people overcome that,
Right.
And get to that true self, and
Absolutely.
in our spare time outside the office, we're trying to do our best to be good citizens and affect society in a positive way, but those ingrained aspects that you're talking about.
Right. One of the issues too, and the reason why I wanted you all to come on is because there's not a lot of talk about what you all do. Had it not been for the 2 of you, I would have had no clue that you exist. Like, what is that? You know what I'm saying? What do you do really? You think about the chiropractic part of it. It's like, okay, well, you're just gonna snap my neck and my back and then throw me out the office and then tell me to have a good day, and then you're working on my nerves, and you know what I'm saying? Like, you don't put these things together. You don't really know that, like I said, that you exist, what it's good for, why we need it is not a conversation. And especially, like I said, with my people in particular, we need to know that you're there. We need to know that this type of therapy, this type of healing is available, and take action. We need to participate in our healing as a whole. I'm not dismissing anybody else, but in particular, I am talking to Black people. Okay. I said, we do not heal. We have learned to deal with or dismiss, not acknowledge, act like something didn't happen, blame it on other people, or stay in our traumas. We've never learned to heal. And there's so many different aspects of healing. And we don't talk about the brain. We don't talk about the emotional healing. We don't talk about the spiritual healing. We don't talk about how the brain, the neurological system is connected to all of that. You know, you can't heal one part and not heal everything else and be considered whole. Everything has to be healed. And you all doing what you do is such an amazing God given gift and skill. And I'm just in absolute awe, first of all, that you exist. and that you've agreed to share yourselves, to share what you know, that you're on my platform. You don't get it. Like, I'm very honored by this. I'm very honored that you have agreed to be here and let people know what it is you do and why it's necessary. We need you. Okay, we need you. And I'm telling my listeners, the people who are here that will be here, go tell somebody, we need these doctors. We need this type of help. We need this type of healing. We cannot be whole if we don't take care of everything. People do not talk about stuff that we actually need to talk about that will lead to the full healing, because there is an agenda. Believe it or not, there is an agenda for us not to heal. There is something there. I'm sorry. There is an agenda for us not to heal. So what we're going to do is the complete opposite and work on the healing. Whatever I have to do to aid in that, you already know I'm with it. The doctors that are here, they're in agreement. They're here. Okay? They're here. Don't let this be a show where with good information and then you do nothing about it. You got access to these doctors. I'm going to give you the numbers and the addresses, the emails, all that. It's posted, but I'm going to repost it. I'm going to have the doctors tell you out their own mouths how to reach them. Utilize the information. It means nothing if you don't apply it. Knowledge is nothing if you don't apply what you know. You have to heal. They're giving you the medicine. The medicine is the information. Take it. Do something about it. They're here. They are here. I said, one of the biggest issues is that we don't know what's available. We don't know. I looked up chiropractic neurology just to see how many there are, how many practitioners there are. There's 500 in the world? Huh? I said, that's gotta be, that's they had to have missed some zeros. 500 in the world? That's crazy. No pun intended, but that's crazy. 500 chiropractic neurologists that help people's brain heal, function properly. 500. That's ridiculous, but that's what it is. We need you.
Well,
Docs.
you got a bunch right here in the A, so.
Okay, right here in the A. Absolutely.
We have a lot.
Yeah.
We have a lot technically in the Atlanta area. Like I said, we've only got 7 doctors. That sounds a lot to Dr. Bauth and I, but that doesn't sound a lot, compared to a small corner of Keystone Hospital.
Right.
Sure. There's 7 doctors in the restroom. One wing of Keystone Hospital at any one time.
Right.
Let alone on the floor treating patients. So,
right.
And we're a relatively young profession. We've only been around for about 40 years.
Okay.
But we need more people doing it for sure.
Absolutely.
And that's part of our visibility challenge. We really appreciate the opportunity to come on and talk about what we do.
Absolutely. Thank you for having us today.
Yeah.
My pleasure.
Sometimes we bury our heads in the sand and we're so focused on treating people, but we need to do a better job getting word out.
Absolutely. Absolutely.
Being upfront and honest, for being upfront and honest, getting the word out is something that we're weak at.
Absolutely.
So we really appreciate the opportunity to do that.
Absolutely. I'm definitely going to have you all back. Yeah, I definitely want to have you all back if we can get together and maybe, create an event where you all are out there. Let's do it, because it's so necessary. It is so necessary. And I said, not just to, my people in particular, to people, period. It's necessary for the overall healing of the being, for the overall healing of of mankind, period. It's necessary. The more they know and have access to, the better we can be. And I talk about this too, as far as karma and history repeating itself. I said, we don't have to. There's nothing that states we have to repeat history. But the reason we're doing it is because we're still in the same mind. We still think the same way. Nothing changed in the generations. Nothing changed. We're passing these diseases on. We're passing these ideas on and traumas on. If when we get to a point where people say enough is enough, I'm going to stop these generational curses, I am the end of it, we change history. It doesn't repeat. The new beginning starts. We don't have to repeat it. Everything that we're experiencing has been done. It's happened before. We don't have to keep doing it. We don't have to. Take advantage of the information and the opportunities to work with these doctors. And I'm pushing my doctors. Of course, I'm pushing my doctors because I know what you do. If you're not in the Georgia area, find somebody that does this work. Find them. Go participate, get yourself involved, be active in your healing, and then bring somebody, bring a friend, tell a friend, bring the community, have an event, whatever it is, but get it out. These doctors are here for a reason. They know what they know for a reason. And it's not just to have plaques on the wall. Okay, the plaques mean, excuse my French for those who are offended, shit. The plaques mean shit. Okay, it's what they do with the information that got them the plaques, that got them the degrees, what they do with it. You can tell by the way they're discussing the information, the way they talk, that they're sincere about what they're doing. I don't let just anybody, let me make this clear. I don't let just anybody on my show. Okay, I don't care how long I've known you. I don't care what you do. I have to vibe with you. I got to feel your energy. Like it's got to be real for me. And the two of you, y'all know how we get down in the office. Okay, y'all know it's always real. It's professional, but we gonna laugh, and that's because it's real. But we connect that way because I know you're genuine. You know what I'm saying? I trust you literally with my life. For me to say that out of my mouth is real. That is real. I trust these doctors with my life. So if you are in Atlanta, if you are in a Georgia area, you need to connect with Dr. Bauth and Dr. Patterson. And I will put that information up again. The Georgia Chiropractic Neurology Center. Okay, I will definitely put that information up, but I will also let the doctors tell you out of their mouths so you can hear it straight where they're located, how to get in touch with them directly if you have any other questions or if you want to make an appointment. So we can wrap this up if you like, unless you got something else you want to share. I'm open. I got no time limit.
Well, you said it. We can put it in the. I think I put it earlier in the thing. Georgia Chiropractic Neurology Center. Mm-hmm. It's in Marietta, Georgia. The phone number is 770-664-4288. That's 770-664-4288. Either Patterson or I are always available for a consultation, and see if it might be a good fit for you, and then we take the next step. But yeah, I'm willing to field one last question if anyone's got one. I can't speak for a doc, but I'll let him say his piece.
Okay.
Myself as well. I'm up for some more questions if they're there. But and if you're tuning in from outside the Atlanta area too, we can try and help you find a doctor closer, or there are patients that travel from out of town to see it. Because unfortunately, like Kimberly said, there's only about 500 of us out there doing this work. So I was working today with a patient from Alabama, one the previous week from Nashville, and I see a lot of patients from the Northeast as well and other areas. But when possible, we try and pair up people with practitioners that that are close to them. So,
yeah, it's hard though because they're not there.
Right.
So sometimes people have the means and the resources to travel to us and stay for the week for an intensive, and that works out really well for some, and for others, you got to try to get it to where you can get it to local. Sometimes it's a challenge, but
Right.
we're out there.
You definitely are. And you're worth traveling to. You're worth the travel.
Appreciate that.
Absolutely.
Yeah, we appreciate that.
Absolutely. I said, we're going to get together, figure out what we can do to get you all more visibility, get more people to come in and see you, to experience true health, true healing, and true power of self. We got to do it. So we're going to figure out something. You all are going to come back, hopefully. I definitely want you back, and we will have these technical difficulties taken care of because people want to see your faces.
Yeah, sorry that was.
I put my nice shirt on and everything.
I know, right? Well, you see, I'm representing you. I'm representing you.
I see that. I appreciate that.
Absolutely. Okay. Well, is there? I would like to ask you both to give a final word to people that are listening or that will be listening. What would you send them off with as far as the information or anything directed, specifically to or for themselves? What would be your last words to give to someone at this point?
Go ahead, Doc.
I usually like to talk about, how it's never too late. A lot of the patients that we see, especially in the brain injury community, they're like, all right, you got about 6 months to a year, heal over the course of that time. You can do some work, you can do some rehab, to try and get better. And then, you got what you got. And that's what you're going to live with. And one of the beautiful things about the brain, and one of the things that makes it challenging to work with too, but certainly one of the beautiful things is that it can change and adapt. So the truth of the matter is, and the research is backing it now, is that it's not too late. Where you're at doesn't have to be your new normal.
That's it.
We can look at it from a more physical standpoint. If you're not happy with your weight, you can do diet and exercise, and you can bring yourself into a new realm as far as that goes.
Right.
And the same thing can happen with your brain as well. It changes and it adapts until the day we pass on to the next thing.
Right.
So it's never too late. That 30-year-old patient that I talked about that improved their reading, that was me.
Yeah.
I got to work with Dr. Ellis, the director of our clinic, and my reading comprehension improved at 30 years of age.
Wow.
And I was in chiropractic school learning all this neurology info, and I got that much more efficient with it. My reading challenges have gone all the way back to the beginning, to like first, second grade.
Wow.
So that was life-changing for me, and it allowed me to help that many more people. So
Absolutely. That's
when I realized it's never too late. It was a big awakening for me. So if you've been told that this is your new normal, I'm sorry, but that's not true.
Right.
Like, you have the possibility to change and adapt and grow and be a more complete human being. And if we can be a part of that, or we can help you find the people that can get you to be a part of that, then, that just brings that much more joy into our lives to be able to help provide that service. So
Absolutely.
It's never too late.
Thank you so much for that. Thank you for that. Dr. Bauth?
Really wish I would have went first on that one. No, talk about taking the words right out of your mouth.
Okay.
Well, the reality is, I couldn't agree more. Earlier I mentioned it's so standard for us to see people who've been everywhere and been told, this is your norm, and you're gonna have to learn how to live with it. And if you're out there listening now or in the future, and you've heard those things before, and you've wondered, like, really,
Right.
is this all I get
Right.
Is this it? Take a chance, that
Right.
they are not right.
Right.
It's possible, right?
Absolutely.
So yeah, that's one thing, and I think that ties in fairly well with your most recent point about some of the cultural stuff, because in my 26 years in practice, doesn't matter who you are, I don't care what your complexion is, what your age is. The only thing that is really a major determining factor on success or not is that person's drive.
Right.
And if they got it and they want to change some things, they can change some things.
Right.
And what they look like, where they've been, what they've been through, that doesn't matter, because that's in the past.
Right.
Right. And it can factor, but it's not the only thing.
Right.
And I talk to elderly all the time, like, well, it's just old. I'm just getting old. Like, well, is everyone your age or older worse?
Right.
No. Well, then it's not age.
Right.
Sure, it's a factor.
Right.
Right? Sure, it is. Is everyone who's been through whatever you've been through, are they worse?
Right.
No. Okay, then that's not the only thing there is it?
Correct.
Okay.
That's
so,
it.
Yeah. That would be my final point.
Okay. Excellent points. Again, I appreciate both of you for just being. I appreciate you for agreeing to be here and sharing your wisdom and your information, your time and your spirit. It means so much to me and to those that are willing to receive you. I am definitely looking forward to having you both back. Maybe not too far from now. Again, okay. I might have to get you on here regularly. We might have to do that. Just have a show just for you all, because it's needed. Because I know there are going to be a lot more questions. I know I will definitely have way more questions, and make it so that people will be able to actually call in and talk with you directly. So perhaps we should work on that.
It was a joy to be here. Thank you so much.
Yes, thank you for having us. Thank you for everyone that participated in the conversation.
Absolutely, absolutely, my pleasure. All right. Well, I will not keep you all any longer. It might be past the bedtime for some of you, but again, I appreciate you all for being here. We will be back next week. I don't know what we're talking about, so just wait to see. But you know what it is. I love you on purpose with purpose. And until I see you again, peace.
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 Have a good night.
You do the same, love. I guess we finished. Peace, y'all. Hello.
Hey, sorry, I just realized I hung up probably too early.
Oh no, you were good. No, you're fine. You're fine. Like, too late now.